Okay, Athera, sorry I've taken so long to mark this. I really do apologize. Anyways, interior front now size of Arab children. Let's see how you did here. Okay, so, having a difficult time reading this. Legend of normal variations in AF size have helped. Okay, yeah, good. So you're discussing the issues and why we do examine the AF, and that's great. Routine examinations of newborns. Okay, that's good as well. And then racial differences. That's really what you want to highlight here. I think this is a little redundant with the routine examinations of infants. Yeah, you can incorporate that into the top part. Remember, you need to be efficient with your words here. And then the aim. Great. Okay, you have that there. And okay, so the methods of material. Who, good, random, normal delivery, good. The gestational age. Okay, you got rid of this part. That's good. The where, good. The when, excellent. How it was conducted. Okay, so that's fine. Okay, this might be going into a little too much detail here, how it was collected and things like that, okay? And then the result, oh, sorry. The results, separate standards for males and female, excellent, okay? And the discussion, I'll just zoom in here. Patient's difficult. Okay, good. Okay, that's maybe something that, this is a detail that maybe you don't need to talk about the thick hair. The racial differences, absolutely. Okay, yeah, this is repeating search for modes of morphogenesis abnormalities. Again, this is a repeat from the introduction. You don't need to do that. Assessing AF size accurately, standard techniques, and appropriate. Okay, so when you paraphrase this, you need to make that very clear, okay, that you're talking about. This is where most students don't do well, the paraphrasing of this information. So you need to make sure that you understand it well. You have all the correct information, that's great. You would get 4 to 4 for this outline. Okay, let's see how you did on the next one. MS in Oman. Sorry, gotta zoom in again. Okay, inflammatory. Okay, good. You're defining what it is. That's great. Prevalence of MS is considered to be low in Asia and Middle East. Good. You might want to mention that there's no studies done in Oman. The aim is to determine the clinical characteristics of MS in Oman. Reasons, studies, for clinical features of MS in okay, good. Okay, methods and material. Who? The Omanis. Okay, good. Where? Excellent. Okay, where it was done. When? Good. How it was conducted. Okay, you have the posers criteria. Great. The results. Okay, this number here, the 1-to-1 ratio, not important, right? They don't talk about this ratio at all in the discussion. This is a good example of including information that we do not need. Okay, this statistic, though, the 10 out of 30, is excellent. That's exactly what we need. I don't know what this means. 2343? I'm not sure what that is. Okay, discussion, unexpected factors, potential genetic factors, optical spinal problems, good. You need to talk about the prevalence, okay? So what the prevalence was, the fact that it was very low in Oman. I mean, the title of the article was that it's MS in Oman, right? So we would be talking about the relevance there. So you're sort of missing that information there. Okay, so let's see how the write-up looks. Sclerosis. Okay, so first of all, you can't use a shortcut. You can't use an acronym in the title. You have to use the full word, MS, multiple sclerosis in Oman. And now used MS, good, okay, which is the lowest amongst Asia and Middle Eastern. Okay, is inflammatory disease, essential nervous system. Okay, I think you have this sort of backwards, okay? You need to define it first and then talk about how low prevalence it is, and that there's no studies in Oman. So I think you'd lose a few marks here because you didn't talk about how it's not common in Oman. Okay, 16 male, 14 female, diagnosed. Okay, with Poser's criteria solved in Caboose University. Okay, good. I think you've done a good job here paraphrasing the methods and material. Good job. The study was performed through neurological examination or evaluation, the latest demographic. Okay, again, you're talking about the ratio here. It's not important. The patients, good. Okay, so I don't think this is important here, the 23 here, and the progressive in 4, and the primary progressive in 3. Yeah, these are not statistics that are mentioned in the conclusion, and it's not really that important. However, comparing to other studies, Oman have the highest incidence of, okay, good, but they have the lowest incidence of MS, right? So you need to mention that, and you also need to mention the numbers here, yeah? Moreover, potential genetic factors. Okay, future studies. Okay, great. Okay, so you've done a really good job here, but you've just missed the focus a little bit. So you would lose some marks here for the stats and here in the introduction. But generally speaking, quite good. Okay, good job.